Hi everyone, I'm Prashant Shah. I'm the Global Head of AI for Intel Health and Life Sciences. I'm also an AI advisor to All of Us Precision Medicine program that's been created by the National Institutes of Health, which aims to enroll about 1 million participants in the program and track their health and wellness journey over a period of 10 years. And this and the goal is to collect the data to foster biomedical research. So AI and machine learning has been around in healthcare for a pretty long time. It's been over a decade since a lot of machine learning techniques were used to train models on historical data in order to make predictive models. The problem with these type of machine learning models was that as you gave more historical data to the model, at some point the model was pretty accurate as far as making prediction goes, but the accuracy started to plateau after a certain amount of time. So no matter how much data you gave this model to train on, the accuracy would not improve. With AI and deep learning, the use of neural networks, the accuracy of these models continue to increase as more and more data is given to these models. So AI is really data hungry. The more data you can give the model, the better, the more accurate the model can be. However, it's not very easy to get access to large amounts of data sets, especially in areas like healthcare, where the data is pretty siloed and fragmented around the world. So data is there in hospital systems, and there are a number of reasons why data is not shared that easily. The number one reason being, the data security and privacy laws around HIPAA, GDPR, which make it very difficult to share these data sets in order to train these type of models. And sometimes the data is also too valuable or it's of unknown value. People have data sets, they know that data is an asset, but they don't know how much value to assign to this asset. And so they just hold on to the data. And sometimes the data is just too large to transmit, especially in areas like pathology images or fMRI images. These can be very large images, and it's not easy to move these data sets around. So there's another big problem in healthcare AI, and that is that all these, a lot of the models are actually biased. There's been a lot of articles in the last 3 years of how AI models discriminate against certain type of people, that sometimes the model actually works very well in your laboratory, but as you deploy it in various hospitals, the models don't provide very accurate predictions. And these type of issues have been plaguing the healthcare industry for a very long time. And so it's very important for data sets to be shared from across the world so that you can build a model that can work anywhere in the world, not just in one institution. So in order to, so one of the more traditional way of actually building an AI model is by data sharing. And so let's say a research organization or a company wants to build a model to predict pneumothorax in lung X-rays or COVID-19 in lung X-rays. They have to actually negotiate with every hospital system and say that, give me all your radiographs of patients with COVID-19 data sets. And the hospital system has to then take these data sets and then they have to de-identify or anonymize these data sets. And that has to happen for every hospital. And then the model is trained on a training infrastructure, and then you get a model. But there's a lot of friction in the system, right? It's very hard for hospital systems to move all this data around and do all the anonymization of all these data sets. So federated learning is an approach by which the hospital systems don't have to move the data at all. The data can stay where it is. Instead, the model that needs to be trained is sent concurrently to all the different hospital systems. And the model trains on these data sets locally. And from time to time, the trained models from each of these sites are aggregated in this central server. And then these models are combined and then sent back to each of these healthcare institutions for further training. And this cycle continues until you reach a sufficient level of accuracy. So the advantage of federated learning is that the data can stay at the sites, data doesn't have to move. And all you have to do is have some compute at each of these sites that allows you to train these models. And so that makes it pretty easy for model builders to negotiate with these hospital systems, because now they are more inclined to participate in training of these models. So back in 2018, we started doing some research around, is it feasible to actually train models in a decentralized and a federated manner? So we collaborated with University of Pennsylvania in the United States, and we set up a federation of about 5 sites in order to train a model that can do brain tumor segmentation. And what we showed is that, so we wanted to ask a couple of questions. How much better does an institution do when training on the full data across all the different sites versus just their own data? And the answer was really surprising and really interesting. The key answer was that if each of the institutions, back in this previous slide that I showed, if each of the institutions were to just train their own model for brain tumor segmentation, the accuracy of the model would be fairly low. But when hospital systems collaborate in a setting, in a federated learning setting, the accuracy of these models actually are much better. And we published this paper in Nature in 2018, or actually we published this in 2020, that talks about all the different approaches that we tried in order to train these models to the state of the art accuracy. So what we wanted to show was, can you get the same levels of accuracy doing a federated training as opposed to doing a centralized training? And so this black line is the centralized training, which means that this is the best you can get if you were able to get access to all the data and be able to train. This is the baseline. This is the baseline against which you're measuring yourself. And then with federated learning, you can get pretty close to to the centralized training paradigm. And so we were able to get to, I think, 99.6% of centralized learning, which means that you're able to get the same levels of accuracy without any institution actually sharing their data sets. So you may want to, you may ask that, hey, what good is it if you're getting the same levels of accuracy? Why aren't you getting better accuracy? The problem, the challenge is that you want to actually, by doing federated learning, you are opening up avenues for more hospital systems to participate. And so this is comparing 5 hospitals centralized and 5 hospitals federated. But our belief is that if you do federated learning, you'll have potentially 20 or 30 hospitals participating, in which case, of course, the accuracy is going to go even higher. And that's what we actually did. So we scaled this particular work across, more than 50 institutions are participating in this brain tumor segmentation challenge. And these are all the different hospital sites that are contributing data. And the model that has been created is, of course, state-of-the-art brain tumor segmentation model. And so we've shown how to actually scale this to a large number of sites without any of these sites actually parting with their data sets in order to train this model. And this work, you can follow this work on the UPenn website, and it's called the FETS, which is a Federated Tumor Segmentation Initiative. So what are some of the key drivers for adopting federated learning? As I mentioned, one of the key drivers is data privacy, right? These healthcare data sets are, of course, private, and by doing federated learning, you're getting around the issue of having to share these data sets that contain personal health information. The second one is, of course, around the communication efficiency, meaning that you don't have to physically move these data sets. The data sets can stay where they are. And since only the models are getting updated, the amount of traffic over the network can be substantially low. So these are the two main things. But data privacy is interesting, even though that the data sets are not actually moving outside the hospital firewalls. There have been some known attacks where these models that I showed, if somebody gets access to these models, these intermediate models, they can infer a lot about the data that is in these hospital systems. And so there is a new attack vector in order to, and so it's pretty important for you to actually protect and secure the federated learning. And that's the main body of work that Intel has been doing is, how do you protect a federation? Yes, the data is not moving, but the models are moving. So how can you actually set up the system in a way that nobody can actually inspect these models or get access to these models, and all this workflow is happening in a highly secure environment. So what does it take to secure federated learning? One is, of course, confidentiality. Protecting the data and models from the risk of exposure to untrusted parties during the execution time. Execution integrity. You want to make sure that where these models are training, that the systems that are being used to train these models are the systems that are authorized to train these models. So you want to make sure that there is no rogue participant in the federation, and that the machine that is being used to train these models haven't been changed. And then, of course, attestation is just as important. Validating that the software and the hardware are genuine, that there is no malware, or there is no certain only those machines that are authorized to participate are participating in the federation, and there's no rogue player in the system. So underpinning all of this is one technology that Intel has. It's called the Secure Guard extensions. And I won't go into the technical details of this, but essentially what this does is that the entire training process is running in a secure enclave, meaning that even if you have physical access to these systems in the hospital, even if you have physical access to these systems, or a hacker has physical access to these systems, they cannot actually, or even if they have root access to these systems, they cannot actually inspect the memory or be able to take these models and uh, and create the next startup, right? So that's the guarantees that the secure guard extension gives you, that you are running all these processes in a secure container, which is enabled by SGX. We've the work that we've been doing with UPenn and others, this started off as a research work, um, but now we are actually doing a lot of productization of this framework that can be used for federated learning. And Intel is a strong believer in open source, especially when you're dealing with any security or privacy related product. You want to make sure that people know what is actually running behind the scenes. And so we have open sourced this framework, and the three main pillars of this framework is that we are focused on security of federated learning. We are focused on making this very easy to use, and then the third one is being able to scale to hundreds of potential sites, and be able to scale to a large network of federation. We also have a paper that we published that goes into the architectural details of federated learning. Lastly, I just want to talk about some of the work that we're doing in IH. And there are two programs that I'd like to use as an illustrative example of how governments could set up such type of programs. The first program is called the All of Us Research Program. This is using a centralized approach of data, right? So here they are following, they're basically enlisting a million participants. They're volunteers. I've signed up for it. Anybody living in the United States can actually sign up for it and give access to the EHR data. Time to time they ask certain survey questions, physical measurements. You provide biosamples, and they plan to do whole genome sequencing of all the participants. And they also collect data from Fitbit and Apple iPhones, right? So you can provide access to all this data. So all this data is being collected into a centralized database, and then there's a researcher interface. It's called the Research Hub. You can go to this website and then request for access to some data, and like depending on whether you are IRB approved or not, you get access to either sort of anonymized data, or you get access to personal health information after you've gone through after your project has been approved. So this is the All of Us program. This is taking more of a centralized approach. Recently, I've been working with NIH to incorporate federated learning in this in research. And one of the key aspects of this Aim Ahead program that was launched more recently, it was launched just a few months ago, is that the sites that have access to data sets from those who are not represented in biomedical research, those sites can participate in a federation, and the data is all going to stay local. It's not going to move. There's no privacy issue, but all these hospital systems that have access to all these data sets can be governed by these sites themselves, but they participate in a federation such that model builders can train the models on these data sets, and these data sets don't have to move to a more centralized location. So this is using federated learning. This is using centralized learning. I don't think there's one, each of these approaches have pros and cons. There's no one size fits all. And so NIH has two different programs doing two different approaches. But the future, I believe, is going to go more and more towards a federated learning type of an approach where the data sets can stay where they are. I hope you learned something new in this talk. If you have any questions, please contact me at prashant.shah@intel.com, or you can follow my work on LinkedIn as well. Thank you very much.
Thank you very much indeed. And for the Q&A session, we also have a participant that can easily answer on those questions. So Mario Romao, Director EU, IE, and Global Healthcare Policy, Intel Corporation, on the Zoom. Good morning, Mario. How are you?
Good morning. Thank you very much. I'm very well. It's a pleasure and an honor to be here.
Wonderful. We have many questions, in fact, coming in from audience. Considering artificial intelligence in the healthcare system, I will try to pack them somehow together and deliver for you. So the first question, in fact, is what are requirements both for state through policy and regulation and healthcare institutions need to ensure in order to implement efficient artificial intelligence models? So what state should do, what healthcare system should do for the artificial intelligence to work?
Right. Actually, there is a few things that I can list right now. First of all, is to have a stable and clear data policy set up. As colleagues mentioned before, data is key. If there is no clear established framework or data governance, it will be extremely hard to be able to develop AI. So I would say actually that data policy is probably the key aspect here.
So we have to start with the data policy, and only then we can go further, because if there's no rules of the game, then the game is impossible, we could say so. There is a lot of questions, in fact, about those requirements. Another focus we can put on is about skill set. What skills hospital teams need to develop to take benefits of artificial intelligence and data management? So could you elaborate on this a bit?
So that is also a key question and issue. AI is a multidisciplinary tool. You will need computing experiences, IT experiences, software experiences, but also data science experience, obviously machine learning, neural networks experience. But this will not do anything good if it's not linked to the doctor, the professionals, the healthcare, the researchers, the bio type of people with this background. So there needs to be a multidisciplinary team set up, and as such, skills and education programs need to set up inevitably.
Okay, clear and understandable. The next question is, taking into account that patients need to be empowered to have more control over data, and the same current regulations are at the national level, how we can stipulate cross-border cooperation? Can you a bit open up this cross-border issue in the field?
This is the €1 million question. You may know the European Union is exactly now debating that. So there is a program being set up called the European Health Data Space. And the idea is exactly to set up a framework and the rules of the game to be able to exchange data or to have access to data across borders. And as we know, we have the GDPR in the European Union. It's slightly different, its implementation in every member state. And as such, one of the requirements that I said at the beginning ends up by being to come up with a level playing field. So that is not really too difficult to exchange and share data. Irrespective if it's federated learning or a centralized model, the GDPR is needed and it's actually an obligation in any case. But if it's not clear exactly and the rules are very different, it's really hard to get a level playing field to do European scale research.
Okay, thank you. The next question also, in fact, goes hand in hand a bit over the fields of healthcare and going to politics. The question is about that in the core, building a good artificial intelligence model is amount of data, that there's a lot of data. What about public trust giving data and how it goes? What politicians can do about that and what the healthcare system can do about that?
I think we all have a responsibility. Companies, researchers, academia, politicians, civil society. That is key. Trust is paramount. So having trust in the institutions of the country, having trust on a cross-border level exchange of data. It also means having clear rules that people, you and I, can really understand. What's the data being used for? Do I have control over my data? If these rules of the game are not set up and are not easy to understand, it will be very, very difficult to have trust across the European Union. So I would say clear and understandable rules and transparent rules of the game. This is paramount.
Wonderful. The next question is more on role of doctors when the artificial intelligence will work properly, how the role of doctor will change, what physicians really will do.
So I like to say that computers don't cure diseases, doctors do. And I believe in this, and it will be like this for many years to come. So, some people, instead of artificial intelligence, call it augmented intelligence. So we need to see it as a tool that doctors, nurses, healthcare practitioners can actually use to speed up, to inform, and to support their already stretched work. So the idea is that in tandem with technology and the human doctor, the results will be faster, will be perhaps more accurate. And then we can actually have more time to take care of patients, since, as we know, there is a scarcity of healthcare professionals across Europe.
So the quick answer would be that giving more time for physicians to do their job. Thank you very much. The final question is, which country within the European Union at this particular moment of time could serve as a role model building up artificial intelligence possibilities, or maybe clusters of countries, but where we can look upon the example how to do things properly?
I think it is difficult to set up, to pinpoint a country. All countries have, smaller and larger countries have their own assets and have their own good things. I think that the key is that it's a complex problem. It cannot be solved by a single country. And here the strategy needs inevitably to pass through joining forces, working collaboratively across countries, across companies, across academia, involving the patients and the healthcare professionals to get somewhere and to actually have results today. The patients are today, they need support today, and the much that we can do to support them, we should do.
Thank you. Thank you very much, Mr. Mario Romao, Director, European Union Artificial Intelligence and Global Healthcare Policy, Intel Corporation. Thank you very much and have a nice day.
Thank you. You too. Thank you.